pelvic floor therapists for men? 100% yes. That is a very good question, and for some reason, a common question to ask. The reality is, it doesn't matter if you're a male or a female, you have pelvis, you have a chance of pelvic floor dysfunction, and the treatment is the same. The reality of it is that your presentations may be different because of very common reason, and that is, believe it or not, most men seek care of pelvic floor therapists not because they have chronic back pain or chronic SI joint pain, but it typically involves their penis, and that's when they think it's emergency 911. That's the reality of it. So they tend to postpone things, and issues are a lot more chronic, typically speaking. Now, I need to bring to your attention that pelvic floor therapy is not just done by pelvic floor physical therapists. I'm not a physical therapist, but I treat patients with pelvic floor dysfunction because my approach is from biomechanical perspective. You see, to me, I want to stabilize the house that pelvic floor is the floor of. By stabilizing the pelvis, I'm addressing the reason why the muscles inside the pelvis were impacted. They didn't just one day randomly decide, let's just start having symptoms that's going to cause, or just cause issues that will create symptoms in this individual. They're reacting to something. We need to investigate what that something is. And it's never one thing. It's a collection of things that need to be addressed. So, do men seek pelvic floor therapy? Yes. Are there therapists for it? Yes. But you gotta understand, majority of pelvic floor therapists go internally. The type of exercises that are given are not the kind of exercises that I would recommend. Why? Because your body part's not in isolation. We're not isolating, or we shouldn't be isolating a specific muscle and try to relax it. We gotta address why it's not relaxing authentically, and 99.9% of the times, from my perspective, it's an issue that has to do with breathing. Then the guidance for breathing, in my opinion, is very mediocre at best. It is not comprehensive because it does not address the whole trunk. We use terms like belly breathing or diaphragmatic breathing, and I see many people doing it incorrectly. So the kind of breathing that I'm a huge fan of is what I call biological breathing, which is inspired by studying human babies. Through breathing is when we relax these muscles on the inside in the process of breathing in, and when we're breathing out, it's the contraction of these muscles that facilitate that process. So we want to provide the grounds that naturally are provided to us to naturally address these issues. We want to address the lifestyle of the individual, how they're working out, what kind of a sitting or standing job they have, what kind of a posture they have, when do they work out, do they masturbate, how do they masturbate. These are all biomechanically speaking play a role. So as someone who focuses on biomechanics of the body parts, we start stabilizing the pelvis. And when you stabilize the pelvis, you see what it takes to stabilize it. You understand what your default moves are. You stop yourself committing those default moves and you replace them with the right moves, and you will have pelvic stability. Now your body has what it takes to perform what it was designed to be doing to begin with. It's really very simple, but for some reason it doesn't get done. So if you have any questions, If you have any comments, make sure you put it in the comment section below. If you need help, contact my office and I'll be more than happy to take a look and see what's going on. Until next time, take care.